Hello, good morning. Hello. Hello, hello. Happy Friday, everyone. We're going to get started, and we'll just, I'll be opening the remarks this morning for today's really important topic. Please, enjoy your breakfast, grab coffee. You can get up and walk around and grab some more food and drink as you see fit. So welcome to Toronto Rehab at the University Health Network. We are sitting in the auditorium of our University Centre here at Toronto Rehab. So if you haven't been here before, this is truly one of the great hospitals, not just in Toronto, not just in Ontario, but in fact across the country. And you're going to hear more about it today, what makes it really special here at Toronto Rehab and at UHN. So we knew today would be a full house, and for good reason. The topic, as you'll see on the screen, is solving the caregiver crisis. But before we get into that, I do want to make a couple of acknowledgements, and I'm going to try to do this from memory. If I have to run back to the podium for my notes, please accept my apologies for that. But firstly, I want to acknowledge a great friend, advocate, supporter, ambassador of Toronto Rehab and healthcare and the community broadly. And the gentleman's name is Bob Blakely. Bob, if you could raise your hand, please. Bob is a very humble man. So Bob, up until June of this year, was chair of the board of Toronto Rehab Foundation. And I should tell you, my name is Yelle, and I'm president and CEO of Toronto Rehab Foundation. But Bob was our chair for a number of years and has served on the board as a director for many years, over half a dozen years. I think it was 7 years, and still is on the board. Bob has been a steadfast supporter of this particular seminar series, these breakfast sessions, which we've actually branched out into webinars too. We do live webinars a number of times during the year, and we beam them out to you on social media, online, so that you don't actually have to come here. You can hear about the great things that are happening from your computer, wherever you're sitting, whether it's at home or at work. So we'll let you know more about that for future ones. But Bob has been a steadfast supporter of this session. It actually is possible thanks to Bob. And so when he stepped down, when he ended his term as chair of the board of the foundation, our foundation our board of directors decided to name this seminar series, these information sessions, the Blakely. I'm not sure if you can see it, but it's called the Blakely Health Innovation Series. So it will forever be known and be recognized as for Bob and his family. So a round of applause, please, for Bob Blakely. So I think we've said this before, at least 1,000 Canadians every single day for the next 25 to 30 years are going to turn 65. Actually, I heard the number's not 1,000. I heard it's 1,500. 1,500 Canadians every day for the next 25 to 30 years will be turning 65. So we've known about this boom generation, kind of all the great things the boom generation has done for our country. But as they go through the system, and I'm on the tail end of the boom, it's going to be a drain. And there are going to be challenges for sure. And we see them, and they're coming quickly. And so the caregiver crisis kind of addresses that. Before I introduce the speakers, I actually like having a little bit of audience participation. So I have a question for the crew here today. I know you had a piece of paper on your table. Before you came here today, though, were you aware that there's a caregiver tax credit? How many of you, honestly, before reading what was on your table, before coming into this room today, were you aware that last year the government put into place a caregiver tax credit? Raise your hand if you knew that. Okay, one more time. Really high. I'm not raising my hand. I was not aware. Okay, I'd say that was about 20% aside from the healthcare workers. 20% of you, only 20%, 1 in 5, estimate knew that there's a pretty significant tax credit. So this is what we want you to do. We want you to be aware of it. You're going to hear more. We don't want you just to be information gatherers, though. We want you to be information disseminators. You need to share this information within your network. Really, really important. Caregivers are going to become more and more important. So family members, friends, partners, spouses, children, daughters, sons, grandchildren, to be for us to be able to kind of handle this boom generation, again, turning 65, 70, 75, 80, 85, and so on. You need to be sharing this information within your own network. We're doing it, we're starting to do it, and we're going to do it more dramatically over the next number of months. We need you to help us on this front. Okay, enough about me and my ramblings. I do want to introduce the speakers today. Firstly, we have Dr. Samir Sinha. Samir, if you could raise your hand, please. Dr. Sinha is a renowned physician scientist in Toronto, but really across Canada. He has an appointment at the University of Toronto, the Faculty of Medicine. You have an appointment at Johns Hopkins. You were a Rhodes Scholar? A Rhodes Scholar. Wow. That's really a big deal. And Samir also heads up geriatrics here at UHN, but also at Sinai Health. In 2012, I believe it was, the government asked Samir to be the architect of the senior strategy for Canada. And so very fortunate to have him kind of in the house, so to speak, and leading the drive on this front. It's important. We also have Dr. Jill Cameron. And Jill, actually your background is as an occupational therapist. Is that? No, I've got that. Occupational scientist. Okay, so apologies for that. Jill focuses on caregiving again, as it relates to stroke, as it relates to disability. She's a scientist here at Toronto Rehab as well. So we're going to hear about the work that she does on that front. We also have Dr. Tilak Dutta. Tilak is also a scientist here at Toronto Rehab. He has a background in engineering, so an interesting take on things. Him and his team of 25 scientists and PhD students look at technology for independence and confidence. So think about someone being in hospital for a period of time and then transitioning to home. What are the technologies that could help that individual and their family manage their care once they get back to their home setting? So I think that's it. We have a lot of special guests and sponsors. I'm going to acknowledge them. I think they're on the screen here. So thank you so much, again, Bob, but thank you to all of our sponsors for making these breakfast sessions possible. We're very grateful.